The polio virus has been detected in wastewater samples in 2 counties just north of New York City. State health officials say hundreds of people may be infected with a potentially serious virus, and they're urging people to get vaccinated. The nation's first confirmed case of polio in almost a decade was discovered last month in Rockland County, New York. So I want to bring in Dr. Denis Nash. He is a distinguished professor of epidemiology at the City University of New York Graduate School of Public Health. Thank you so much for joining us. So we had heard about this case not too long ago, and I think it was really shocking to people that polio would pop up. And then we learned that it was different than the polio of years gone by in that this was a vaccine-derived form of polio. So it shows up in Rockland County, but the transmission did not begin in the U.S. Can you talk to us a little bit more about how the path of this polio virus was traced?
Sure. Yes, as you say, the inactivated version of the vaccine-derived version of the virus does circulate in places where that vaccine is being used around the world, and where there are many unvaccinated people, there's a chance for that vaccine-derived virus to circulate in the population as well among unvaccinated people. And as a result, if unvaccinated individuals were to travel to these areas where there may be vaccine-derived polio circulating, they can become infected and bring it back to other areas of the world, given how interconnected the world is.
I read that, officials have been testing sewage water in different places, and that's how they're able to see that it's popping up in different cities, even though this form of the virus, often there are no symptoms or very mild symptoms. So there may be people walking around and they don't know they have it.
That's right. Even with wild-type poliovirus, most people who are infected don't have any symptoms. But you're correct. Wastewater sampling for disease surveillance is really, really important. We saw that for COVID, and we're now seeing its utility for polio. It becomes really useful to know the extent of spread that we might actually have in the community when we don't necessarily see it among cases yet. For every symptomatic case of polio, there can be hundreds or thousands of asymptomatic cases, and the wastewater approach really gives us a sense of how much could be out there.
It's been a long time since I've ever talked about a polio case. What are the symptoms?
The early symptoms include things like fever, fatigue, and headache, and vomiting, and there can be neck stiffness and pain in the limbs. And of course, longer-term symptoms, it can progress in some individuals to paralysis or worse.
Yeah, that would be terrible. Dr. Denis Nash, thank you very much.
Thanks for having me.